Hello everyone, I'm revising the specialization exam for internal medicine. I am working in Germany as a doctor, so I would be explaining some of the slides which I found very relevant for the preparation for the antibiotics therapy. If you are interested, you can join me in my journey. Without wasting the time, I'm just showing you the slide for the antibiotics therapy. And before starting the antibiotics therapy, it's always recommended to take the blood cultures and begin with a calculated antibiotics therapy. And if you don't have any focus, then you should stop the antibiotics therapy in the right time. And you have to think what kind of antibiotics, the indications very carefully and critically, so that you just don't develop any kind of resistance, and de-escalate if the infection or if the patient is getting better, and try to oralize the antibiotics if it's possible. And yeah, and what kind of what kind of infections are more relevant in our clinic? There are catheter associated infections, which is most probably in the blood, and Staphylococcus aureus, Candida, and endocarditis, which we see so often. Apart from that, even the urinary tract infections and pneumonia, they're so common and can be either with the typical, atypical bacteria or even the fungi. And before beginning with the antibiotics, always recommend you to take the cultures, blood cultures, urine cultures, yeah, sputum test, cough from the cough. It's really recommended, and at least two pairs so that you have high sensitivity. And what is the clinic in this case is fever. If you have the lines, central lines, which is at the beginning it's red, or if it's some secretions are there, if the patient is in shock, if has continuously fever, and if the catheter is not functioning, on take the blood cultures, and if you have the any kind of bacteria or any pathogen which is grown up, then you have to think critically. It's there is a high possibility of a catheter associated infection, and take it out. What I found very interesting and which was new for me was this differential time to positivity. For example, if you have blood culture from the peripheral central line, and in the central line the pathogen just you just found that in 3 hours, in periphery it just came out after 8 hours, then you just have the focus, it's the central line, take this out. Yeah, there's a high chance, and it's differential time to positivity to just find out the pathogen, and based on the pathogen just begin with the calculated therapy. And if you have the antibiogram, then just go according to the antibiogram if it is sensitive to the pathogen, and just kill it. And what's the recommendation is you have to remove the catheter. Yeah, you have to remove the central line, Sheldon, anything you have which is the focus. Yeah, but if the patient is stable, if it's not infected, or if you don't have any possibility for other catheter, then keep it up. But begin with the antibiotic therapy in both of the cases. Systematic. Just begin with the intravenous antibiotics therapy, yeah? And there is also a recommendation from the IDSA guideline, and it shows that when you have to remove the catheter, for example, Staphylococcus aureus for coagulase negatives, and Staphylococcus, remove the catheter even for the Enterococcus gram-negative bacilli. By Staphylococcus epidermidis or hominis, you can keep the catheter, but you have to give the antibiotic therapy for at least 14 days, 7 to 14 days it is recommended. And after 3 days, take the cultures to see if your patient is free from bacteria, because it is related to the mortality of the patient. How do you begin with therapy? Just begin with Berish with vancomycin, and apart from that, by immune compromised patient, you have to add piptas or cephalosporin, and de-escalate according to the antibiogram, and also remove the catheter if there are Staphylococcus aureus, Enterococcus candida, and gram-negative pathogens we already discussed according to the Infeolong. And And the other new thing was antibiotic lock therapy. You can even add the antibiotics in your catheter and treat the catheter. And I have here a table for the antibiotics. Like I would begin with this vancomycin. You just take around 500 milligram in 10 ml, and you just remove 1 ml, dilute with 9 ml sodium chloride, and then take 1.5 ml of this mixture with 5,000 units of the heparin, and draw around 3 ml and apply in the tunnel. It is interesting, but I have not seen any clinical studies. If you find, just post it.